Well, good morning, everyone. I'm here to give an update on our stay-at-home order. This week is the projected peak of the illness. And like everyone here, we certainly look forward to seeing when these numbers start to decline so that we can make some more progress. But what we're doing is working, and I just plead with the people of Alabama, keep doing what you're doing. Social distancing, personal hygiene, staying at home when you can. And remember, and as a reminder, our current stay-at-home order stays in effect through April 30. Last week I talked to you about the shift in focus from our people's safety and health to include also the economic health of our state. In my mind, those two have been closely interwoven since the very beginning. As most people can appreciate, this requires a strategic approach as well as a team effort to strike the proper balance between keeping our people safe and healthy and also addressing our state's overall economic health. In addition to Scott Harris, Dr. Harris joining us today, are a few members of a team who will help make Alabama's recovery a success for all of our people. And as you'll recall from last week, I announced that an executive committee of my coronavirus task force would soon begin working to put the pieces of this puzzle together. And I'm pleased to say that they've already been hard at work. These 7 individuals will work closely with Dr. Harris and me to go through the many recommendations that we're receiving in order to safely open our economy. We can do this, and we will do this. And I'm as eager as anybody to get our economy back open, spinning on all cylinders again. But again, we have to be careful and cautious in what we are doing and do it in a smart, productive way. Our State Finance Director, Kelly Butler, is chairing my executive committee, and you will hear from him in just a few moments. And I expect Director Butler will lay out how this group will put all the pieces together so that Dr. Harris and I can determine when, how, and in what way businesses will reopen. Y'all, we have Alabamians and Alabama businesses hurting right now. We certainly know who you are, and we want to help each of you get back on your feet just as soon as possible. Labor Secretary Fitzgerald Washington is also here with me today to give you information and updates on people who are seeking unemployment compensation and where they stand in the process. And I know Secretary Washington and his folks are working overtime and overdrive to get this work done. My office and I have been in touch with our congressional delegation because we want to see Congress replenish the funds in the Paycheck Protection Program. This program is absolutely critical to our people, especially to our small businesses. Already here in Alabama, financial institutions have made close to 28,000 Paycheck Protection Program loans, totaling around $4.9 billion with a B, and that's just here in Alabama. Banking Superintendent Mike Hill, from whom you'll hear in a few minutes, will give an update on what this program looks like for Alabama's small businesses. As I've stated several times, getting our economy back up and running is not as simple as flipping a switch. And there's been no shortage of good ideas that have been sent to us, and they're coming from all corners of the state, and that's a good thing. We've heard from our Small Business Commission, and I appreciate the Lieutenant Governor and his group for providing some good recommendations on pathways forward. Tomorrow, we'll hear from our Federal House delegation in Washington. We've also had numerous suggestions from legislators, mayors, private citizens alike. I know that Dr. Harris agrees, but every good idea deserves to be considered. And together, he and I will be working closely with our executive committee to get Alabama's economy back up and running again. My fellow Alabamians, during these unprecedented times, you have truly given new meaning to the words, "Together, Alabama." It's been a challenging month. We've lost too many of our loved ones, and our way of life has been turned upside down. But better days are ahead. We all look forward to that, and I'm confident that our better days are ahead. Thank you so much, people of Alabama, for your partnership and willingness to sacrifice for the greater good. Now I'll call on Dr. Harris to give us his update. Dr. Harris.
Thank you, Governor. Good morning, everyone. The snapshot for where we are today shows that we have about a little over 5,100 cases that have been confirmed so far in our state. We have deaths in around 167 or so, I believe, at when I last checked this morning. We have reached the period where we thought we may have a hospital surge, and that surge has been contained within our hospitals, and we're very happy about that. As people have stayed home and stayed away from others who are sick, we've seen numbers improve in a way that we're very pleased with, and that makes us feel a lot more confident going forward as we make decisions about what to do next. Last week, the White House issued guidance to all states about things to consider as we make moves to open up the economy again. Many of you may have seen that press conference with the President. They issued really excellent guidelines that will give us a great way to consider what Alabama should do next. The main things that they wanted to consider were for hospitals to be operating within their normal capacity and have the ability to take care of everyone that needs taken care of without resorting to their emergency standards of care. And we feel like that we are managing to do that right now. They had
We are having technical problems right now. We are listening to Dr. Scott Harris. He's the Alabama State Health Officer. We've been listening to Governor Kay Ivey. Now, what we've learned so far until we can get that sound back up is that she did thank, everyone from Alabama. She said that this week was the projected peak of the coronavirus in the state. She also encouraged us to keep on doing what we're doing because it is working. She says that stay-at-home order is still in effect until April 30th. Now, she did say a committee is being put together to start making a plan to reopen the state. Obviously, she said every county is different, so that's definitely something to keep in mind. She said that committee is about 7 folks, but again, it's not as simple as flipping a switch, she says, to get the economy back up. Again, that stay-at-home order is in effect until April 30th. She does say that better days are ahead. Now, who we're listening to right now, Dr. Scott Harris, he says that the hospital surge has been contained and that the numbers are improving in our state. Now, we did just see the number. We look like we had 175 reported deaths in the state of Alabama, over 5,100 reported coronavirus cases here in the state. As you can tell, this is on our website. You can find that for more information. But again, we are listening to Governor Kay Ivey. We are having some technical issues. If you're joining us this afternoon, we're trying to get that fixed as we speak. But again, she did say this week is the projected peak of the coronavirus. Now, yesterday we heard from Mobile County Health Department. Dr. Randy Murphy and Dr. Eichhold says we haven't seen that peak just yet. Also, Mobile Mayor Sandy Stimpson said that the city of Mobile did see a peak on April 10th. Now, this may not be the peak we were talking about, but there was a peak for the city of Mobile on April 10th with coronavirus cases. But again, we're taking a live look at that dashboard as we speak, and you can find this on our website now. It looks like we have fixed that issue, so sorry about that. We'll listen back in.
Small business admission report, Friday. We've received numerous recommendations from various groups in Alabama, mayors, business groups, individuals. All of that has been taken into consideration. We have also been mindful of the information that came out yesterday from some of our surrounding states and what they're doing. And the direction to us has been to make recommendations as much as we can based on data, based on facts, and that's really the Commission's order and directive, and that's the path we're trying to take. So thank you.
Well, good morning. Thank you, Governor Ivey, for giving this opportunity to update everybody on what ADOL is doing to help the citizens of Alabama deal with the crisis called COVID-19. Just 4 weeks ago, our office has received 306,000 new filings compared to 130,000 claims all of 2019. So you can see the surge of claim filings that's had impacted our agency. I am pleased to announce that $164 million has been paid to over 104,000 people that have been impacted through no fault of their own as a result of COVID-19. We also paid out $100 million just yesterday. So that totals $264 million that we paid, again, to people that have been impacted through no fault of their own. Now, we are seeing that there is a trend in terms of mass filings. In the last 2 weeks, those filings actually have been trending downward. And it looks like we've hit our peak versus the way it was 3 weeks ago. Now, I know that there's a lot of tension out there. There's a lot of frustration from people that have been having some difficulty in trying to file their claims. We certainly understand that. Our staffs are working diligently to make sure that those claims are filed and move through the process. 40% of the people that have filed claims have been paid. 40%. Now, our agency is not going to be relaxed. We're not going to be satisfied until we satisfy making sure that the 60% get their payment. We also have made some improvements over the last 3 weeks to help expedite claim processes. We actually moved our UI, or unemployment insurance claim portal, to a cloud-based systems. And so we're actually seeing a whole lot of results, positive results as a result of that. We also entered into an agreement with a outside call center vendor. That outside call center vendor consists of about 100 people. They actually started yesterday, and just yesterday alone, they took in over 650 calls. And then finally, we also put together a really nice tool called the UI, or Unemployment Insurance Claim Tracker, where the claimant can actually track their filing from the beginning, get updates during the process, and also see those benefits go to the end. These are just some improvements that we've done just to expedite the process to get more people get their benefits. And again, I know there's tension, and I know there's a lot of frustration on a lot of people that are trying to get into our system. Our staffs are working tirelessly to make sure we respond to those demands. We continue to ask the public to be patient as we continue to come up with new processes so we get more people paid. So that's my update. Thank you, Governor.
Thank you, Governor, for having me today. Forgive my scratchy voice. It's that time of year. About a month ago, Congress and the President passed legislation to stimulate the economy by putting $2.3 trillion back into the economy to offset the consequences of the coronavirus pandemic. Part of the program was for banks to make 100% SBA guaranteed loans to small businesses. The purpose of the whole program was to help the citizens and businesses to survive the pandemic while they were forced to close or partially close their business, and while many citizens were being laid off from their jobs. I want to thank Governor Ivey for her encouragement for state banks to participate and for small businesses to utilize these loans. I want to discuss the small business part of the legislation that Congress passed. The Act set aside $349 billion for banks to make loans with 100% SBA guarantee to small businesses in the country. These loans would be forgiven if the money was used for specific business purposes, such as employee salaries, utilities, maintenance, and other operational expenses. There were 1.6 million loans made by nearly 5,000 banks across the country. Alabama banks completed 28,000 loans totaling $4.86 billion. The bank should be commended for participating in the program. This is not a loan a bank would typically make. The loans were only allowed 1% APR for a maximum of 24 months. And just to let you know, SBA loans are complicated, even though the Act made it as simple as possible. The time frame for the banks to prepare for these loans was so short. It was signed into law on March 27th, and without a lot of guidance, 7 days later, banks started taking applications. All loan volume was completely utilized and approved by SBA by April 16th. Alabama banks spent long hours and weekends completing this process for 28,000 loans. The success of the program is helping small business in Alabama. Alabama is 24th most populous state, but with the $4.86 billion in loans placed, Alabama rankings 19th out of 50 states in payroll coverage. The governor is encouraging Congress to speak to pass another package of over $300 billion in new loans. There was over $1 billion of Alabama business loans that had been applied for but did not get funded before the total pool was depleted. Also, there was an estimated 5,000 loans that is anticipated to be applied for in the next stimulus package above the loans that have already submitted. Again, I just want to thank the governor and the Alabama banks for making this program a success. The state and its people will be much better off financially as the end of the pandemic nears. Thank you.
The governor will open us up for a few questions now.
On yesterday, Governor Cuomo announced that the National Governors Association will be asking the federal government for $500 billion to help with shortfalls in state budgets. Either you or Kelly. How much will Alabama be requesting that $500 billion, and will that cover shortfalls in FY20 and or FY21?
Kelly, you want to take a crack at that?
So we haven't put a number on what we would request. We haven't been asked to do that and have not done that. We have estimated our shortfall based on the last conversation with our economists for the general fund and the ETF might approach about $1 billion.
Yes, sir.
Given that number, how are you expecting to make that shortfall? Has that discussion happened? I mean, are raising taxes or are things of that nature being discussed as possible ways to make that money up?
Not at the moment. Our first priority is worried about the health of our people and getting the whole economy and the decrease in our COVID-19 numbers down so we can consider going back to work. Lydia?
Other southern states, even Georgia, bordering states, other southern states are beginning to reopen their economy as early as this week. What will it take for Alabama to make that decision if that can go perhaps?
Well, we've got an executive committee of the coronavirus task force, and Kelly's fixing to leave and go have a meeting with them in Birmingham as we speak. And that committee will be receiving all the other ideas that have coming in, and we'll have a very definite, specific timetable of what, when, and how our businesses can open, and we'll do that as soon as we can.
For those who are restless, maybe seeing Georgia opening up, people here are restless or wanting to work, what's your message?
Nobody wants to open up businesses more than I do. We had a 2.7% unemployment back in February, and I'm eager to get back to that. Rashawn?
Governor, over the weekend you spoke with your fellow Southeast governors talking about plans to open up that kind of thing. Was there any plan, were there any discussions as to those plans? Given what Lydia just mentioned, our neighboring states opened up, what were those conversations like with your fellow governors?
Well, the 5 governors that I visited with over the phone, they're all eager to open up the economy as we are in Alabama. Testing is still a challenge for them as well. And until we get enough testing done, we can't fully reopen the economy. But we're all in the same boat. We're working together and sharing ideas. And some states are opening sooner than others. But every governor is responsible for reading the numbers and doing what they think is best for their state.
And on the issue of testing, are you satisfied with the state's testing response?
Beg your pardon?
Are you satisfied with the state's testing response?
No, we're not testing enough yet. We're a little bit less than 1% of our population, and we need to do a whole lot more testing to get up to speed. Yes, sir.
For Dr. Harris, like Governor Ivey just said, not only are we testing, I think we're at maybe 1% of their areas, like the Wiregrass, that have even fewer tests that have taken place at this point. What benchmarks for testing would you feel comfortable with in agreeing to any efforts to resume economic activity?
Sure. I don't think there's a set number that we would use that would automatically, answer that question. I think we want to feel comfortable that we can test people when they need to be tested. And right now in some parts of the state, that means that we take a consultation from a doctor one at a time and try to arrange a way for that individual patient to get testing. I think someday in the future, and no state has really solved this problem yet, but someday in the future, we would like testing to be available just like any other testing is available. And if you need to get a rapid strep test or you need to get your blood glucose test, you see your provider, and it could be any clinic or urgent care or doctor's office, and have that done. No one's near that yet, and we certainly don't have to wait to reach a position like that where we can do it. What we do need to be able to do, though, is to be able to respond as public health when we see outbreaks occurring. We need to be able to get to an area where we have multiple cases reported, to get those people tested as quickly as possible and to do contact tracing on those people as quickly as possible.
Just as a follow-up, if we were to reopen the economy today or next week, are you comfortable that the state has the resources to respond, God forbid, to another outbreak that could occur in that situation?
Yeah, I think we're still trying to make decisions about that. We have improved our testing tremendously. Again, the ultimate goal of having that widespread testing that I referred to is not going to be realistic for any state to see anytime soon. But we are increasing our capacity. What the guidance that we have received repeatedly from HHS is they say to us, we understand that public health labs aren't doing most testing in any state. Continue to work with academic medical centers and commercial providers to develop testing capacity. And that's what we've done. Most of the tests in our state are being done by those other entities. And so we continue to try to get them to amplify their capacity as much as possible.
I might add to that, certainly the Department of Public Health testing, but on top of that, we've had a few private labs and UAB start testing, so they are adding to our testing capacity.
Dr. Harris, this will be for you. Can you speak to the situation in nursing homes right now? We hear about some outbreaks in individual facilities, but as a whole, we know the National Guard is calling this one help with some cells.
Sure. So nursing homes are one of the areas that we have a lot of concern over because they house our most vulnerable citizens in Alabama. All nursing homes everywhere in the country have worked very hard on this problem. Every state, I think probably literally every state has had nursing home associated cases, or certainly most of them have, and we're no different here. We have been working since the very beginning very closely with nursing homes and through their association to make sure that they are aware of this and prepare for it. I think I've mentioned to you guys before, but nursing homes are actually really good at handling infectious diseases because they do have to deal with that a lot. If they have outbreaks of gastrointestinal illness or influenza, so they spend a lot of time thinking about those. So we have worked very closely with them on their own policies and procedures. We limited visitors, as you know, which we understand is really a hardship for a lot of people, and we didn't do that lightly, but we felt like that was the best way to try to keep people safe. The nursing homes themselves are screening all the people who do come in the building, their staff or those kind of necessary vendors that have to come into the building. Many of them have done testing even on asymptomatic people just as a way to try to look for cases that aren't having symptoms, and many of them are looking for ways to try to cohort those patients who are positive. That is, patients who test positive who aren't really sick enough to be in the hospital can hopefully be put together in a dedicated wing with dedicated staff and dedicated equipment so that they're not mixing with others that aren't infected. And then on top of that, the National Guard has worked very closely with us and the nursing homes to do decontamination projects, particularly in those homes that have had cases, although I think they're probably available to do that in any home that would need that. And we really appreciate that support. General Gordon has helped us get that arranged, and it's a terrific thing that's been well received by the nursing homes, and we think that that'll help prevent a lot of infections.
Do you know how many facilities around the state have outbreaks currently?
That is known. I don't know how many there are. I'm sorry, I just don't know the number right now.
We have time for a few more questions. Governor, just to be clear, is it your plan to keep all the orders in place through the 30th? And how can we look at reopening next month if testing is still a problem?
Well, stay-at-home order is in place at least through April 30th at this point. And but before we can fully open and get fully operational, we've got to increase our testing capacity.
And again, following up with Brian's question, what would be adequate testing in your opinion?
In my opinion, doesn't count. It's the health people that help us know how much we got to test. And remember, all of our decisions that I'm going to make are based on data, not a desired date.
Governor, in a few cases, in a handful of instances, we've seen businesses that have either threatened or attempted to reopen in defiance of these state orders. What do you say to businesses who are trying to do that or at least threatening to? What is your message to that?
We've got to lower this COVID-19 rate. It's got to start declining more than it is, and it needs to do that over a period of 10 to 14 days. So you just have to read the numbers and don't get impatient. We've simply got to do our part, one person at a time, social distancing, personal hygiene, staying at home if you can, go to work if you can, but at the same time, we're doing everything we can to encourage folks to file for unemployment and encourage people to apply for federal insurance and federal assistance. The federal government's doing a good job of trying to provide those resources. Lydia?
Okay, Governor, if we're saying we need to wait until there's more testing before we can reopen the economy, but then we don't have a benchmark as to how many tests we're waiting for, it's leaving a lot of people here waiting, saying, okay, what are we waiting for? We don't have a number of how many tests we're waiting for. We don't have the testing capacity. So how can we be data-driven if we don't even know how many more tests we need to have?
Well, we got to have more than less than 1% of our population, that's for sure.
Gas is cheap, the weather is nice, and people are ready to get out of the house. So you can hop in the car and go to Florida or Georgia, Tennessee. What is your message to Alabama to maybe considering that? And how concerning is that to you in regards to slowing down the spread? People possibly going to one of our neighboring states just to get out of the house?
Well, I think clearly people need to take seriously the guidelines about social distancing. We sure understand this has been a hardship on so many people. As other facilities open up around Alabama, I know there's a temptation to take advantage of those. And I would just ask people to please remember that we're trying to protect those most vulnerable people in our state. You know, even for people who feel like they're young and healthy and not particularly at risk. There are certainly people perhaps in their own home, but certainly in their community who are at risk. And we just need people to try to remember that just a little bit longer. It's been, I'm sure, a terrible time for many people for quite a while. And I believe that there's dawn is breaking pretty soon. But we still just have a little bit further to go, and we just hope people can hang in there a little bit longer and try to protect people in their family and in their community.
And we have time for one last question. Okay. The White House has recommended 14 days of downward trajectory in new cases through gated phasing of reopening. Is that going to be our benchmark? Are we going to strictly adhere to those guidelines that they put out?
Well, that's a good benchmark to work toward. 14 days of declining new cases.
But are you going to strictly adhere to that, or is that?
I plan to.
Where do we stand on that now? How many days have we had?
Mike, we've had, it's posted on the public website, and you're welcome to see it there. And so I don't want to misquote you when you can look it up right away. But we've had somewhere around 5 or 6 days that have mostly been below, I think all but maybe one day have been below that 200 case per day mark that we've been seeing for quite a while. And so they're still leveled off at that point, and we think maybe this is the inflection point on the curve that we're looking for. But we still probably need to look at data for another few days to know for certain.
All right, and thank you guys so much for your questions. That is all the time that we have today.
Thank y'all so much.
Thanks for joining us here on Fox 10 News. I'm Chelsea Sayasan. Now, we just heard from Governor Kay Ivey and other leaders in our state. A lot of new information was given out, and we want to see what some of our local leaders have to say about the changes and progress. Our Hal Sherrick joins us with more in Baldwin County. Good afternoon, Hal.
Hey there, Chelsea. I'm here at Orange Beach City Hall. I've been in communications with Mayor Tony Kennon here, Mayor Robert Kraft in Gulf Shores. Both we're intending to watch the governor's press conference as it happened. Obviously, we just heard from her. There's been no accelerated timeline on a prediction of reopening businesses, reopening beaches. Right now, things stand just the way they've been. Not expecting anything earlier than April 30th as far as a stay-at-home order, opening any businesses. And you also heard some talk of needing a 14-day timeline on a continued decrease in new cases. So all that taken into consideration is something that the mayors down here say they will have to consider. Mayor Tony Kennon says before he gives any kind of statement as to what the governor and others said in this press conference, he's to consult with his council members. The same in Gulf Shores, Robert Kraft there. They say that as far as giving any reaction to what came out of today's press conference, they would need to consider everything that was said. Obviously, business is here in South Baldwin County rely heavily on the tourism that happens this time of year. Obviously, Memorial Day being the main bookend, but you know, we've had so much business in recent years prior to that down here at the beaches from spring break on, and with the Hangout Music Fest and all that's been canceled, as we know, until next year. It's just a lot of waiting going on and a lot of uncertainty still that is concerning to business owners down here. Just literally, I was thinking on my way down here, Canal Road that's under construction, there's a lot of utility work going on. Normally that would be just congested and backed up. There was no traffic on the road. It was very eerie, and it's been that way all over South Baldwin County, just something that we're not used to seeing. Very hard on many businesses down here. They desperately need to open back up, but as the governor said, just can't do that until the data, the healthcare data shows that it's safe to do that, as opposed to a date that they'd like to see. So all that being said, I'll have some reaction from the mayors down here starting tonight on Fox 10 News at 4 p.m. As they digest what they heard in today's press conference, which was really not a lot new. So be sure to tune in for that starting at Fox 10 News at 4 and 5 o'clock tonight, Chelsea.
All right, Hal, thank you. Well, Governor Ivey says the stay-at-home order is still in effect until April 30th. Now, cases in Alabama should decline for 2 weeks before we talk about reopening and start to see that happen. She says a committee has been formed to plan the economic recovery of the state. State Health Officer Dr. Scott Harris says that the hospital surge has been contained and numbers are improving. Now, regarding unemployment, Alabama Labor Secretary Fitzgerald Washington says that 306,000 Alabamians have filed for unemployment. $264 million has been given out within the last few weeks. He says that the percentage of those filing for unemployment is starting to trend down. Now, there is a new call center and unemployment claims tracker to help assist you. You can find that online. Alabama Superintendent of Banking Mike Hill says that over $4.86 billion in loans for small businesses has been processed in the state. He says that Alabama banks are working really hard, and this is helping our small businesses. Thank you for joining us today. Of course, you can find this press conference on our Fox 10 YouTube page and our Facebook page as well. I'm Chelsea Sayasan. We'll see you at 2:30 with the Mobile County Health Department News Conference.
This has been a Fox 10 News Coronavirus Update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our regularly scheduled program already in